Gentlemen, let's talk about something most men won't discuss openly, but almost every man over 50 wonders about. What really happens to your body when you go through a long stretch without sexual activity? Maybe you've been single for a while and dating just hasn't worked out. Maybe health issues have changed things for you or your partner. Or perhaps life just got complicated, work stress piled up, family obligations took over, and intimacy quietly took a back seat. Whatever the reason, you've probably heard that phrase, use it or lose it, and wondered late at night if there's any truth to it. Are you slowly losing function? Is your body giving up on you? Is it too late to turn things around? I'm Dr. Lila Romano, and I've been a practicing urologist for over a decade. I've sat across from thousands of men asking these exact questions, and today I'm going to give you the honest, science-backed answer. And I promise you, much of what you've heard is completely exaggerated. But there are some real, measurable changes that happen, and it's absolutely critical you understand them. Stay with me because by the end of this video, you'll know exactly what's myth, what's real, and most importantly, what you can do starting today to maintain optimal health and vitality, whether you're sexually active right now or not. Okay, let's start by clearing up the biggest myths I hear. Myth number one, if you don't use it, it'll stop working completely. Here's the truth. Your body doesn't just shut down because you've taken a break from sexual activity. You're not going to wake up one morning and discover that everything has permanently stopped functioning. Your tissues, your nerves, your hormonal system, they're all remarkably resilient. Think about it this way. Your body is designed for survival and adaptation. It doesn't give up on core functions just because circumstances change. Temporarily. Yes, there are adjustments that happen, but permanent shutdown? That's not how human biology works. And myth number two, I'm too old to bounce back anyway. Gentlemen, I'm begging you to let go of this belief. I have patients in their late 60s and 70s who have successfully restored satisfying sexual function after extended periods of inactivity. Age slows down the recovery process, absolutely. But it doesn't prevent recovery. The difference between a 55-year-old and a 75-year-old might be a matter of weeks in recovery time, not whether recovery is possible at all. Your age is not a life sentence. Now, here's what is true. There are some real, measurable changes that can happen to your body during extended periods without sexual activity. These changes aren't catastrophic, but they're absolutely worth understanding so you can take simple, proactive steps to maintain your health. And that's exactly what we're going to walk through together, step by step, in plain language. No confusing medical jargon, just the facts you need to know. Let me start by explaining the foundation of how everything works. Your entire reproductive and urinary system depends on three things: blood flow, muscle tone, and hormone levels. Think of these as three pillars holding everything up. When all three pillars are strong, everything functions beautifully. When one weakens, the others have to work harder, and eventually, the whole structure becomes unstable. But here's the good news: you can strengthen all three pillars with the right approach. When you have regular sexual activity, whether with a partner or by yourself, you're essentially doing maintenance work on all three pillars. Let me explain how. Sexual arousal increases blood flow dramatically to your pelvic region. That increased circulation keeps your tissues healthy, elastic, and well-nourished. It's like watering a plant. When you water regularly, the plant stays vibrant and supple. When you stop watering, it doesn't die immediately, but it starts to wilt. The tissues need that fresh, oxygenated blood to maintain their responsiveness. When you reach climax, your pelvic floor muscles contract rhythmically. These contractions are like a natural workout for those muscles, helping them stay strong and toned. And strong pelvic floor muscles are critical not just for sexual function, but also for bladder control, core stability, and even posture. These muscles do more heavy lifting than most men realize. And finally, sexual activity interacts with your hormones in complex but important ways. Testosterone, the key male hormone, influences your desire, your energy levels, your muscle mass, and even your mood. Regular sexual activity helps keep these hormonal pathways active and responsive. It's like keeping a well-worn path through the forest. When you walk it regularly, it stays clear. When you stop, the brush starts growing back. Now, I also need to tell you about something most men don't know exists: your nighttime maintenance system. During REM sleep, healthy men typically experience 3 to 5 erections per night, each lasting 20 to 30 minutes. You might wake up with what's called morning wood, which is just the tail end of your last nighttime erection. But why does this happen? Is your body just randomly activating during sleep? No. This is your body running a diagnostic test, oxygenating your penile tissue to keep it healthy. Think of it like your body running a systems check while you sleep. When these nighttime erections decrease or stop, which can happen during long periods of inactivity, high stress, or hormonal decline, your tissues don't get that regular oxygenation. Over time, this can contribute to loss of elasticity. And here's something critical to understand: these three pillars don't operate independently. They're interconnected. Low testosterone can reduce your blood flow. Poor circulation can weaken your muscles. Weak muscles can affect your hormonal signaling. It's all one integrated system, which is why when you address one pillar, you often see improvements in all three. This is also why taking a comprehensive approach, which I'll give you shortly, is so much more effective than just focusing on one area. Now I know what you're thinking. Okay, Dr. Lila, so what actually changes if I'm not sexually active? What am I supposed to be watching for? That's exactly what we're about to cover. But first, a quick pause. If you're finding this information helpful, hit that like button and drop a comment below. Tell me, where in the world are you watching from? I love seeing men taking charge of their health. All right, let's break down the 4 most common changes men experience during extended periods without sexual activity. Change number 1: blood flow and tissue health. Your penile tissue contains something called smooth muscle. This tissue needs regular oxygenated blood flow to stay healthy and elastic. During an erection, blood rushes into this tissue at high pressure, stretching it and keeping it flexible. When you go for long periods without erections, and this includes those nighttime erections I mentioned, the tissue can start to lose some of that elasticity. Think of it like a rubber band that hasn't been stretched in a while. It still works. It's not broken, but it might feel a little stiffer and less responsive at first when you try to use it again. There's actual research backing this up. A 2019 study published in the Journal of Sexual Medicine followed men who went 6 months or longer without erections and found they showed a 15 to 20% decrease in smooth muscle elasticity. But here's the critical part that the headlines never mention: this was completely reversible within 3 months of resumed activity. 3 months. That's not a life sentence. That's a recovery period. I had a 62-year-old patient who was widowed for nearly 2 years. When he started dating again, he was convinced his body had forgotten how, and that his first intimate encounter would be a complete disaster. He came to see me before that first date, terrified and ashamed. We talked through exactly what to expect. I started him on the pelvic floor exercises I'll teach you in a few minutes. And within 6 weeks, he came back to my office with a huge smile and said, "Dr. Romano, everything works just fine." I just needed to understand what was happening and ease back into it. That's the power of knowledge combined with simple, consistent action. Change number 2: pelvic floor muscle tone. Your pelvic floor muscles are the ones that control urination, support your bladder, and play a crucial role in both achieving erections and controlling ejaculation. These muscles benefit tremendously from regular contractions. When you orgasm, these muscles contract rhythmically dozens of times. Those contractions keep them toned and strong. It's a built-in workout that happens naturally during sexual activity. These same muscles also provide core stability and are connected to your lower back and posture. There's fascinating research here. The British Journal of General Practice published a study showing that strengthening pelvic floor muscles improved erectile function in 40% of men with ED and showed significant improvement in another 35.5% without any medication whatsoever. These muscles matter more than most men realize. The practical reality? When you're not sexually active for extended periods, you might start noticing subtle changes in bladder control. Maybe you feel a slight urgency you didn't feel before. You might experience occasional minor leakage when you cough, sneeze, or make a sudden movement. You might wake up more frequently at night to urinate. These changes typically develop over 4 to 6 months of complete inactivity. And while they start subtle, they can become more pronounced over time if not addressed. Change number 3, testosterone and hormonal balance. Testosterone levels naturally decline with age at a rate of about 1% per year after age 30. That's normal aging. But regular sexual activity helps keep your entire hormonal system engaged and responsive. Research suggests that sexually active men tend to maintain better testosterone levels, though the relationship is bidirectional and complex. Does activity boost testosterone, or does higher testosterone drive more activity? The answer is probably both, creating either a virtuous cycle or a vicious one. A study published in the European Journal of Endocrinology found that sexually active men in their 60s had testosterone levels on average 12% higher than their inactive peers. That might not sound like a huge number, but in the world of testosterone, a 12% difference can mean the difference between feeling energetic and motivated versus feeling exhausted and flat. This can feel like you're losing a core part of your identity. Many men tell me they don't feel like themselves anymore. They feel less confident, less masculine, more withdrawn from social situations. Some men describe it as a fog or a flatness where nothing feels exciting anymore. But here's what you need to understand. This is often hormonal, and hormones are treatable. When we address the underlying hormonal imbalance, men consistently tell me, "I feel like myself again." That's a direct quote I hear all the time. Change number 4, psychological and relational effects. Sex isn't just physical. It's deeply connected to mental health through biochemistry. Regular sexual activity has been linked to lower stress levels because it helps regulate cortisol, your main stress hormone. It's linked to better sleep quality because of the release of hormones like oxytocin and prolactin after orgasm. And it's linked to improved mood through the release of endorphins, dopamine, and serotonin, your brain's natural feel-good chemicals. Multiple studies have shown that oxytocin, often called the bonding hormone, reduces anxiety and promotes feelings of trust, safety, and connection. Endorphins act as natural painkillers and mood elevators. When you go without sexual activity for extended periods, you're missing out on these natural emotional regulators that your body is designed to produce. This is often the hardest part to talk about, and it's the part men suffer with most in silence. Sex represents connection, vulnerability, feeling wanted and desired. When it's absent for whatever reason, many men feel a profound sense of loss. It affects self-esteem, mood, sense of purpose, and feeling alive. Some men describe it as feeling like they're just going through the motions of life rather than actually living. I've counseled couples where intimacy stopped due to one partner's health issue, maybe prostate surgery, maybe menopause complications, maybe chronic pain. And the emotional distance that developed was often more painful and harder to heal than the original physical problem. They stopped touching each other entirely, stopped communicating openly about their needs and fears, stopped feeling like partners and started feeling like roommates. Addressing the physical issue was important, but rebuilding that emotional intimacy required intention, vulnerability, honest conversations, and often professional support from a counselor. The physical and emotional are deeply intertwined. Now, here's the most important thing I want you to hear today. For most men, especially those in their 50s and 60s with reasonably healthy hormone levels and no major underlying health conditions, these changes are not permanent. Let me say that again because I need you to really hear it. These changes are not permanent. Your body is remarkably adaptive. It's designed to respond to inputs. When you resume sexual activity, whether with a partner or through self-care, blood flow improves, tissues regain elasticity, muscles strengthen, and confidence returns. Now, there are important caveats. If you're dealing with significant age-related testosterone decline, if you have underlying health conditions like diabetes, cardiovascular disease, or neurological issues, the changes can be more pronounced and may require medical support. And that's completely okay. There's help available, and asking for it is a sign of strength, not weakness. Diabetes can damage small blood vessels and nerves, which directly affects erectile function. Cardiovascular disease affects blood flow systemically throughout your entire body. These conditions don't make recovery impossible. They just mean you need to partner with a knowledgeable physician who understands male sexual health and can help you navigate the path forward. So, what do you actually do about all of this? Whether you're currently sexually active or not, here are 6 practical, science-backed steps to maintain optimal health and function. These aren't complicated. They don't require expensive equipment or dozens of supplements. Just consistency and commitment to yourself. Step number 1, stay physically active. Cardiovascular exercise improves blood flow throughout your entire body, including your pelvic region. This is non-negotiable for sexual health. Strength training helps maintain testosterone levels naturally. Flexibility work supports overall function and reduces injury risk. Here's what this looks like practically. For cardio, aim for 30 to 45 minutes, 5 times per week. Brisk walking where you can hold a conversation, but with some effort. Swimming, which is excellent for pelvic circulation and easy on the joints. Cycling, though make sure your seat is at the proper height to avoid nerve compression. Too low a seat can actually contribute to erectile problems. For strength training, 2 to 3 times per week focusing on compound movements like squats, deadlifts, and lunges. These exercises involve large muscle groups and have been shown to boost testosterone naturally. You don't need heavy weights. Moderate resistance with proper form is what matters. Within 2 weeks, you'll notice energy improvements. Within 4 to 6 weeks, you'll start noticing sexual function improvements. Your body responds to consistent input. Step number 2, practice pelvic floor exercises. You don't need to be sexually active to keep these muscles strong, and the benefits extend to both erectile function and bladder control. First, you need to locate the right muscles. Stop your urine midstream. That's the feeling, though don't do this regularly as it can confuse your bladder. Or tighten as if you're holding back gas. You should feel a lifting and tightening sensation without tensing your abs, glutes, or thighs. There are 3 types of Kegels, and I want you to incorporate all 3. Quick flicks build responsiveness. Contract for 1 second, release for 1 second. Do 10 repetitions. Long holds build strength. Contract for 5 to 10 seconds, hold it, then release for 5 to 10 seconds. Do 10 repetitions. And then there's the elevator technique, which builds control. Imagine you're riding an elevator up 5 floors, and with each floor you contract a little bit more. Go up all 5 floors, hold at the top, then slowly come back down floor by floor. This one is advanced, so start with the basics first. Your protocol is 3 sets of 10 reps daily. You can do these anywhere in the morning while still in bed, during your commute, watching TV in the evening. Common mistakes to avoid: don't hold your breath, don't tense the wrong muscles, and don't do too many too soon thinking more is better. Start where I told you and build gradually. Within 2 to 3 weeks, you'll feel the muscles working better. Within 6 to 8 weeks, you'll notice noticeable improvements in function. This is one of the most powerful tools you have, and it's completely free. Step number 3, consider solo activity. Even if you're not in a relationship right now, maintaining regular sexual function through self-pleasure helps preserve blood flow, muscle tone, and hormonal responsiveness. I need to address this directly because there's still shame around it, but this is legitimate health maintenance, just like brushing your teeth or going for a walk. 2 to 3 times per week is optimal for maintaining the systems we've discussed. Technique matters. Encourage variation. Avoid aggressive approaches that can desensitize tissues, and focus on sensation rather than rushing to outcome. If you're in a relationship and this has become a sensitive topic, it's worth having an open, honest conversation with your partner about maintaining your health. Frame it as health maintenance, not dissatisfaction with the relationship. Most partners understand when it's explained properly. Step number 4, get your hormones checked. If you're experiencing persistent low energy, decreased libido, mood changes, difficulty building or maintaining muscle, or weight gain, especially around your midsection, you need to get your testosterone tested. Here's what to request from your doctor: total testosterone, free testosterone, SHBG, which is sex hormone binding globulin, and LH and FSH, which are your pituitary hormones. These give a complete picture of what's happening hormonally. Understanding your results matters. Below 300 nanograms per deciliter is clinically low and likely requires treatment. Between 300 and 500 is low normal, and lifestyle interventions are often sufficient to bring you into optimal range. Between 500 and 900 is the optimal range where most men feel their best, good energy, good libido, good mood. Above 900 is high normal and usually fine unless you're experiencing symptoms. Treatment options include testosterone replacement therapy, medications like Clomid if you want to preserve fertility, or lifestyle optimization as a first-line approach. Work with a knowledgeable urologist or endocrinologist. Not all doctors understand male hormones well, and you want someone who specializes in this area. Step number 5, nutrition for sexual health. What you eat directly affects your blood flow and hormone production. For blood flow, focus on beets, which boost nitric oxide because your body converts the nitrates in beets into nitric oxide. Dark chocolate that's 70% cocoa or higher contains flavonoids that improve blood vessel function. Watermelon is high in citrulline, which converts to arginine, which then converts to nitric oxide. And leafy grains like spinach and arugula provide natural nitrates. For testosterone support, eat oysters, which have the highest zinc content of any food. Pumpkin seeds provide both zinc and magnesium. Wild-caught salmon gives you omega-3 fatty acids and vitamin D. Whole eggs provide cholesterol, which is actually the building block your body uses to make testosterone. And extra virgin olive oil provides the healthy fats that support hormone production. Foods to limit. Processed foods create inflammation that damages blood vessels. Excess alcohol damages your Leydig cells, which are the cells that produce testosterone. High-sugar foods cause insulin spikes that suppress testosterone production. And don't forget hydration. Dehydration reduces your blood volume by up to 10%, which directly impacts erection quality. Aim for about half your body weight in ounces of water daily. Step number 6. Manage stress and optimize sleep. The cortisol-testosterone connection is critical to understand. Chronic stress elevates cortisol. High cortisol directly suppresses testosterone production. It also constricts your blood vessels, which reduces pelvic blood flow. This creates a vicious cycle where stress causes low testosterone, which makes you handle stress even worse, which further lowers testosterone. You have to break this cycle intentionally. For sleep optimization, you need 7 to 9 hours for adequate testosterone production. 90% of your testosterone is made during sleep, particularly during deep sleep in the first 3 to 4 hours of the night. If you snore or feel tired despite getting enough hours of sleep, get screened for sleep apnea. Sleep apnea absolutely devastates testosterone levels because you're not reaching deep sleep stages. For stress management, try just 10 minutes daily of meditation, deep breathing, or quiet reflection. Create an evening routine to wind down, no screens for an hour before bed, dim the lights, maybe read or take a warm shower. And get your physical activity earlier in the day, which helps both stress and sleep quality. Now, while most changes are normal and reversible, there are a few warning signs that require prompt medical attention. I'm begging you, don't ignore these. Sudden, complete loss of ability to achieve any erections, including morning and nighttime erections, especially if the onset is sudden. This could indicate a vascular or neurological issue that needs immediate evaluation. Pain or discomfort with erections or ejaculation is not normal and requires evaluation. It could indicate Peyronie's disease, infection, or other conditions that are treatable but need attention. Significant urination changes like severe urgency, pain, or burning, blood in your urine, or difficulty starting or stopping your stream. These could indicate prostate issues, infection, or other problems. And profound fatigue, depression, or symptoms that interfere with daily life, your work, your relationships, or basic functioning. This could indicate severely low testosterone, thyroid issues, or depression requiring treatment. And here's something that could save your life. Erectile dysfunction often appears 3 to 5 years before a heart attack or stroke. Let me explain why. The arteries in your penis are only 1 to 2 millimeters in diameter. Your coronary arteries are 3 to 4 millimeters. When you have plaque buildup developing in your arteries, It affects the smallest vessels first. So if you're experiencing persistent erectile dysfunction, especially sudden onset ED, it's not just about your sex life. It could be an early warning that your cardiovascular system needs attention. This is why I never ever dismiss ED as just an aging thing. Your penis might be trying to tell you something critical about your heart health. Don't ignore that message. Let me be absolutely clear about something. If you're not currently sexually active because of circumstances beyond your control, you haven't done anything wrong and you're not somehow failing. Life happens. Circumstances change. What matters is that you take care of your overall health and stay informed, which is exactly what you're doing right now by watching this video. Okay, gentlemen, if you found this helpful, I need you to do something for me. Share this video with someone who needs to hear it. This information could genuinely change someone's life. I'm Dr. Lila Romano, and I'll see you in the next video.